the expert panel on pandemic preparedness and lessons for ASEAN and beyond. So may I please welcome on stage Singapore's Senior Minister of State for Health and Communications and Information, Dr. Janil Puthucheary, and Jacob Angler, CEO APAC at Foodpanda. Oh yes. Right, joining us online is His Excellency Kong Puak, Deputy Secretary General of ASEAN for ASEAN Socio-Cultural Community. We also have Professor Peter Piot, Special Advisor on COVID-19 to the President of the European Commission, Handa Professor of Global Health at the Faculty of Epidemiology and Population Health at the London School of Hygiene and Tropical Medicine, and Visiting Professor at Riga Institute, KU Leuven, and at National University of Singapore. He's calling from Europe. And Mr. Alexis Serlin, Head Asia Cluster, Novartis Pharma, Novartis Asia Pacific Pharmaceuticals. Ucheli, the floor is yours.
Thanks very much, Liana. Well, a warm welcome to all our speakers near and far here at Fairmont, Singapore, and everyone else out there as well. So I believe we've got hundreds tuning in. And I know some of you have to be up extra early just to be here today, so really appreciate your time to be with us. So what's going to happen is we have 45 minutes of this exchange. We get insight from our greatest minds, and we have 15 minutes set aside for a Q&A from our audience here at Fairmont, as well as those of our viewers who are tuning in via Zoom and the various social media platforms. So we have so many questions, but so little time. So let's get started right away, and perhaps we can begin with you first, Minister. I mean, you are a medical doctor yourself, and you're also the second minister in charge of Singapore's Smart Nation initiative. And I guess that couldn't come at a better timing when technology and digital health solutions, they've come to the forefront because of the pandemic. And we have rolled out, from contact tracing apps to like Trace Together app to our telehealth, like what Minister Ong was talking about, how we have expedited and boosted all of that. And clearly, that's the way to go, isn't it? That's the way to go in terms of this digital front door. It's going to have to stay open now, and even post-pandemic, a lot of resources will have to pour in to beef up our digital health solutions.
Well, thank you. Playing my role in Smart Nation and GovTech, I'm a bit torn whether or not I should say we need a lot more resources, or whether we can do a lot with the resources we already have. But if I just roll back a little bit, before the pandemic was a word that we used quite loosely. We were arguing about digitalizing Singapore. We were arguing about a digitally led transformation of Singapore. And our thinking was, we had to invest in our people, we had to invest in a technology base, we had to invest in an infrastructure base, and we needed to create the right type of relationship with the private sector, upgrade our regulations, have engineering talent within government. And all of this edifice was on the basis that we were being disrupted, and we had to be prepared for some unknown disruption in the future. And it was assumed to be economic. It was assumed to be a global competitiveness. But all the things that you talk about in terms of our pandemic response, well, we didn't know that was going to be the great technological disruption that we would have to face. So the ability then to roll out those products, the ability for those platforms to work well in service of the public mission, and the outcomes that we have were all, frankly, not something that we did in the first 2 or 3 months of the pandemic. They are building on things that we've been doing for a great number of years around digital transformation. But having had that base, we were able to move fairly quickly then to open up contact tracing, proximity tracing, and all the different apps that by now we're very familiar with. What has that done then for our digitalization approach, and how should we then take it forward? Well, there's a meme going around, what's responsible for driving digital transformation in your company? Is it your CEO? Is it your CTO? Is it the government regulator, or is it COVID-19? And clearly the pandemic compressed about 10 years worth of digitalization into a handful of months. We've now become, as a people, much more used to the personal social good that technology can drive. You know, it's not just about gaming, it's not about leisure, it's not about consumption. There's a personal good and it has a social impact. And I think that has something that we should ride on as a silver lining to this pandemic cloud going forward. And I think that's something that we can leverage on, and I think we can do much more. And I think that the discussion on the trade-offs and balances for using technology in healthcare is one of those unappreciated good silver linings that have come out of the pandemic, and we should leverage on that going forward.
And perhaps, since we're talking about digital, perhaps I can pose this question to DSG Kong in terms of how can countries, I mean, ASEAN, you know, there's a lot of issues. I mean, obviously, terrible cases in, you know, certain parts of our region. And some people would have said, you know, maybe we kind of dropped the ball on this one. But in terms of the challenges specific to ASEAN in adopting digital tools, which obviously greatly help in contact tracing, etc., how can we even get there? I mean, it seems like a mammoth task.
Well, thank you for the question. And actually, it's a very, you know, challenging task for all the ASEAN member states. To start with, you know, we have different levels of development. This is some things that we have to also take into considerations. Of course, when it comes to sophisticated technologies and all that, it's going to take time for all the ASEAN member states to catch up and put in place the right infrastructures and all that. But some of the tools that are available to the member state in, you know, fighting the COVID-19 pandemic, we can see some of those, you know, technologies are widely adopted by the ASEAN member state. Of course, we have our own framework that would help the member state to work together to invest more in technologies, especially when it comes to infrastructures and so on. For example, the ASEAN Master Plan connectivity and ICT and technologies are a big part of it. But again, for those, you know, investment is going to take time. And again, there's, you know, a very large gap in a way, especially when it comes to, you know, how they are going to, you know, mobilize enough resources to invest in those technologies and infrastructure, and also, you know, how quick they can do that and so on. So it remains a big challenge for us. Of course, we have the framework, we have the policies and tools, everything to support the member state, and we also have a strong partners that are keen to invest and work with the ASEAN member state in this. But of course, it's going to take time for us to really bridge this digital gap, you know, between the ASEAN member state and also within the countries as well. But in short, I should also say is that, you know, when it comes to technologies that enable the member states to contain the COVID-19, they are very, you know, quickly adopted by the member state, and to some extent we can see is that those adoptions have produced some quite, you know, positive result in terms of contact tracing or monitoring the situation, disease surveillance, and so on. But again, I think it's still a long way for us to really make, you know, a big impact when it comes to the investment in digital technologies and also infrastructure.
Professor Piot, now you co-discovered Ebola in the 1970s. And after 40 years of, you know, chasing viruses, you contracted COVID-19 yourself. And I'm wondering, how has your perspective changed when it comes to pandemic preparedness?
Well, thank you for that personal question. And first of all, I'm really delighted to be in Singapore, to say so, even if I speak from Brussels. It's a region close to my heart. As you heard, I'm a professor at NUS, but also my son is living and working in Laos. So I'm quite in touch on a daily basis with what's going on in the region. And I would say that my mother tongue is Dutch, and we have a word that's called ervaringsdeskundige, which means experience expert. You have the theoretical experts, the ones from outside, and I've been one for many years, as you said. But once you have it, you from inside, it changes a bit your perspective. But above all, it has just increased my determination to defeat this epidemic, because I was a very early infection in March 2020. And what was not known then was that there's something like long COVID, and that's what I had. And that means that not only you can have the acute infection, we knew that, I was in the hospital and so on, but then for many months, you know, there were all kinds of complications. And that's a warning sign to when we deal and try to appreciate what is, what this infection is about, we should look beyond acute infections and people hospitalized and so on. So the health impact and societal impact goes beyond that. It also, makes it very clear that this is about people, not just about statistics. And I liked very much, the attitude and the proposals of Minister Ong Ye-kung in the sense of where making it clear we're still learning what to do. But what's important is that we learn from what we do. And that's not always the case. And we need to move now to societies living with COVID. And the main purpose of, the main goal of full vaccination, which I hope that the region, just as Europe, will have achieved as soon as possible, is really to prevent people from dying, from being hospitalized, from getting sick, so that, we can go back to normal life. Although that's not what I should say. We go forward to a new type of life. Like the minister said also, wearing masks when we have a cold and so should become the norm, as it has been in some countries like Japan for many years. So this is, it adds a personal experience, which is always, I think, good if you survive, at least. And, we have to defeat this pandemic and prepare for the next one, because there will be a next one. Let's not fool ourselves. Thank you.
That's right, Disease X. Now I just want to bring in our, private sectors who obviously had to be heavily involved, whether it's collaboration, cross-collaboration and partnerships. And Food Panda, if anything, there's a silver lining. You guys are doing so well with all the lockdown. Everyone is just ordering more food. And I believe you've also transitioned to groceries online and, offer that as well. But I'm wondering in terms of, trying to adapt and trying to, as the government imposed various restrictions, how did Food Panda, getting your staff, firstly, you probably need to be hiring more riders, I assume. But the challenges, and in terms of trying to be nimble, how did you find it? How did you find that for this pandemic?
Yeah, I think as for the full business sector, COVID was also for us a very kind of complicated, challenging time, and of course still is. Food Panda operates in Asia across 12 countries, and so we've seen very diverse, very different COVID situations, and then also very, very different government responses and rules and regulations to follow. So it was a very challenging and difficult time for us, and again still is. And so we as a company, we really focused on really trying to stay extremely agile, really monitoring what's the latest situation, how should we respond, what's the right measure, what's the wrong measure, and really on a very localized approach where we responded very differently in different countries, and also in many countries very differently in different cities. As many other companies, the one thing we really focused on is, okay, in this difficult time, how we as a business can kind of contribute to this all-over situation in a positive way. For us, there's always three major stakeholders. There's the riders, there's the restaurant partners, and the consumers. And so the big question for us early on was, how can we keep our consumers safe? How can we keep our riders safe? And how can we somehow contribute to the restaurant ecosystem to navigate them through this challenging period? And yeah, on all three of those very different measures have been taken. As an example, we leapfrogged our efforts to launch our grocery business, which was kind of in beta, in like very small stage before COVID. During COVID, you also not want to have restaurant food in your four walls, but you might also want to have groceries and other essentials. So we leapfrogged that business and launched it across all our 12 markets. Also, we developed, I think within 6 days, we developed a feature where you can order food and get it delivered contactless, so the rider knows to drop it at your doorstep and not interact with you physically. We boosted our efforts to move from cash payments at the doorstep to online payment and various things. So very, very different measures, and then also very adaptive to different country situations. Yeah.
And speaking of, adaptability, I mean, for Novartis as well, the race, to get the vaccine numbers up and running must be quite a challenge. In fact, you are collaborating with, all these key stakeholders and partners to manufacture vaccines and learning from the, vaccine developers how to produce these vaccines rapidly. And I believe it was also announced that you're working with Roche to produce a drug that's being tested for its effectiveness against COVID-19 linked pneumonia. In terms of cross-collaboration, it is very important during to have this cross-collaboration is very important during this pandemic.
No, thank you very much for the question. Really an honor to be part of this panel. Absolutely. As a company, we basically are very focused on improving patient outcomes and serve our patients. And as part of doing that, we needed to figure out exactly how we could contribute, right? And as you well mentioned, obviously collaborating in infrastructure in terms of ramping up global production of the vaccine was very critical. Accelerating the innovation cycles in order to bring up new technologies that from a medicines perspective, it could also help the patients, because we should also remember that in spite of the existence of vaccines, some patients will get sick, and we need the innovation, we need the medicines to help those patients also. And broadly speaking, also collaboration with the governments, right? We fully acknowledge that it's all the society that needs to be involved and needs to figure out how to manage this pandemic together, and every part of the society has a part to play, right? And a great example here is, for example, in the area of heart failure, partnering with different governments in order to improve patient outcomes and to reduce rehospitalizations, because healthcare systems are overloaded around the world. It's not a different in some countries in Asia. So freeing up beds so that there were more beds available for the patients that were affected with COVID was also a priority, and we could play a part there, right? So it's really taking the long view, understanding that we are all part of this, and figure out how to collaborate with all the different stakeholders, from governments to other pharmaceutical companies, to obviously the healthcare practitioners, and really trying to do our part.
And perhaps, Minister, you can jump in here, and as we're talking about private-public sector partnership in terms of preparing Singapore for a stable economy when disease X strikes, that we are ready to take on another challenge. Through this pandemic, did we encounter some issues in terms of trying to get partners in and trying to get them to sort of adhere to restrictions we have or to our policies?
Well, the private sector has been a very important part of how we've dealt with the pandemic. I mean, it's people's jobs, it's where some of the risk is, the workers are being exposed, and their adaptation is also part of then our social response, so that life can have some semblance of, I was about to say normality, but acceptability. So what has happened since the start? Well, certainly we've had to mobilize the whole of our society, and that was very clear. That was one of our key principles right at the start. How are we going to deal with this? It has to be a whole of society effort, and we can talk about the other principles if that comes out, but in that whole of society effort was the correct partnership and the correct platforms for relationship with the private sector. Whether it came to how we were thinking about some of the legislative changes, some of the grants, some of the regulatory enforcement, but also in terms of creating new opportunities, whether it's around food. Food is our favorite subject here in Singapore, but many other industries pivoted their business model, learning actually from many other sectors about how they could adapt both the customer engagement process, the product delivery, and how they were able to look after their workers. So very much so. Yes, businesses have had to struggle with the restrictions, as have all of us. But what has been interesting, and this is what the professor pointed out, is the opportunity to then learn about what works well and what doesn't work well. So when our next wave came along, as we are currently, we didn't just get the same playbook that we had used previously. We didn't have exactly the same restrictions. We knew that actually within the working space, there was an opportunity to allow a fair amount of activity to carry on with good social distancing measures, with the right type of tracking in place. And so the balance between how much of the restriction is on us in the sort of mask-off social activities versus the mask-on business activities was really quite different compared to what we did at the circuit breaker, what we did at the heightened alert. So we've adapted our restrictions, our controls over time, and a big part of that was the partnership that we had with the private sector in learning how to deal with this pandemic. So I think there's several facets of that partnership, from the actual disease response, whether it's about the vaccine distributions, the rest of the ancillary equipment that we needed, the safety of our population, the return of economic life, but also how we've adapted our restrictions over time. It's also been heartening that in the last couple of years, wearing a very different hat, looking at it from a very different perspective, the private sector as a force in Singapore hasn't been diminished. That despite this ongoing pandemic and what's happened, we've seen startups being created, we've seen investments carrying on. We've had 300 med tech startups in 1 year. That clearly is an outlier because of the pandemic and the interest in medical technology. But the rest of the startup scene has continued. Businesses have been created and started, and that ability to start a new business in the midst of a pandemic, I think, is part of what Minister Ong talked about, part of that resourcefulness and that adaptability that we have and we need to celebrate, and that I think the private sector has an important role to play in.
Now, just going back to ASEAN, we're talking about the game, the game book. Has it changed at all, since the pandemic started till now? Because I want to touch on the ACRF, which is the ASEAN Comprehensive Recovery Framework. I mean, that was birthed, out of necessity to basically coordinate crisis, on a large-scale effort. And I know that there are a few point strategies, and these goals look good on paper, but in terms of translating it to action, where are we at this point? Because the numbers are raging, in some countries in our region.
Well, I think when it comes to our responses to the COVID-19, we learn from the past, the ways that we reacted, for example, to SARS, to MERS, to Zika and all that. And then we come up with a number of tools and policy and framework that would allow us to do something about it. But it's just that this time it's a bit different. We never expect that, the impact is this devastating. So in a way, you can say is that we are not that, completely prepared for such a large-scale intervention by the governments and various stakeholders to contain the pandemic. And the ASEAN Comprehensive Recovery Framework is one of the tools that the member state, put together to allow them to recover from this pandemic. And we look at the framework itself. It contains 5 broad strategies. And what we are doing at the moment is just trying to mainstream all of this, priorities into the work plan of all the sectoral bodies. And at the same time, also assist the member state in also translating some of these priorities into the national policies as well. As you know, that ASEAN is not in a position to implement it by itself. We need to work with the member states, support them as much as possible, work with them to mobilize resources and so on. But we can say is that many of the priorities in the ASEAN Comprehensive Recovery Framework are very relevant, for the ASEAN member state if they are serious about, growing again, or getting out of this crisis. So, for example, on the health side, there's a number of key priorities that we want the region to be prepared for the next pandemic. For example, when it comes to strengthening our research and innovation capacity and capability, we work very closely with the private sectors. And there's a lot of interest among the member state. And now there's discussions at the economic ministers as well on how we can come up with such a framework so that we can engage not just private sector in the region, but also from outside the regions as well. For example, the ASEAN-EU Business Council is very active. ASEAN Business Council is also very active. But another major development in terms of how the member state can kind of look at the framework and try to get something out of it. For example, strengthening the manufacturing base in the region. And I'm glad, Minister Ong Ye Kung just mentioned about, some of the possibilities in Singapore, and there's also, similar initiative in other parts of the ASEAN regions as well. And those are some of the key priorities in the ASEAN Comprehensive Recovery Framework. And as I say, the strategies needs to also further worked on, especially when it comes to specific interventions that the region as a whole can do, and also the national government can do. But again, this is a framework that allows the member state to kind of coordinate the activity, because for some developments in the region require close collaboration, coordination among the member states. It is not something that can be done, by just one government or so. For example, when it comes to vaccination, if you look at the numbers of people who are vaccinated, there's a large gap. And this is some things that we need to work together. It's also part of the frameworks as well. And now the member state are working with the private sector to procure, for example, vaccines just enough, to build the herd immunity and so on. I'd like to also highlight, until now, we only have like 4 countries that manage to vaccinate more than 50% of the population, and you still have another more than half who are still lagging behind. So through this framework, I think it is also some things that they can work on as well. But again, it's a long-term project. Some may need some time to be translated, but all the most important priorities, some things that require urgent actions from the ASEAN member states, we are trying to push that as much as possible, so that the national government can take up some of this and start doing some things in collaboration with partners, not just among the ASEAN member states here.
Because, I'm just wondering, what are some of the consequences, for our region? Just some numbers here. Foreign funds are reportedly rushing out of, Southeast Asian equities, stock flows hitting $2.7 billion. That's according to a Bloomberg report. And I'm just wondering, what are some of the immediate areas, of priority that ASEAN should zero in on?
Well, if my colleague from the economic side would be in a better position to comment a lot on that, because I think that is some things that they are working on. But I think what is important for us at the moment is, to build the region in a way that is really to reopen the economies and grow again. That's why I focus, on 3 major pillars of the ASEAN Comprehensive Recovery Framework. The first one is the human securities, and another one is human health, and also the digital transformations in the region, and so on. But then again, I think when it comes to all of this economic data and trade policies, and so I think my colleague from the economic side will be in a better position to comment on. But again, on the health sector side, we are doing our best, to make sure that when the time is right, and then we can start, growing the economy, but in a ways that, put the safety and health of our people, as the priority as well. For example, we are now working on the travel corridor, and the health sector has been working very closely with the economic side to make sure that when such a corridor being operational, then there will be all the protocols, guidelines, and framework in place, so that it would allow member states to sustain the initiative, not just to open it and then close it the next day or some things.
So back to you, Minister. Are you worried for ASEAN?
Well, we should always worry, because that will prompt us to do things, to make things better, and tweak things and optimize things. But on the whole, the factors which made me hopeful for ASEAN before the pandemic aren't going to change as a result of the pandemic. We have a region, well connected, links between all the member states, a commitment to a certain way of doing things, and building bridges, increasing trade and connectivity. All that will come back. All that will come back, and it will be on the back of a pandemic through which we have learned so much, and that we will continue to learn, and we will continue to adapt to. But coming out of it, we still have that base of a young population that's growing, that's energetic, that's driving economic growth. And so I think if you take that perspective, we have every reason to be hopeful for ASEAN, and that once we get through this pandemic, we'll get back onto driving that type of economic opportunity that ASEAN is so interested in.
Now, I want to pivot the next question to Mr. Piot, because yesterday when I was on the news and I was reading about how the Lancet, which is a peer-reviewed journal by scientists from around the world, so basically they said that a booster shot, for instance, is not necessary just yet at the moment, while some countries like Singapore and elsewhere have already, and US are going to start rolling that out. But I'm wondering, with all this scientific information coming in, I mean, who are we to believe what? And in terms of sharing all of this information globally, isn't it hard to keep up with all that material that's coming in?
Yes, indeed. Well, first of all, let's not forget that one of the, I would say, the biggest challenges dealing with this epidemic is uncertainty. But we've learned a lot. I mean, when you compare to where we were a year ago, for example, we have vaccines. We know that they work. We know that they protect against serious disease and death and hospitalization. So we have learned a lot, but there is still a lot of uncertainty. And scientific debate is actually normal. Scientists thrive on arguing and on challenging each other, and that's makes progress. But the decision makers can't wait for the full evidence, because you have to act now. And when it comes to, for example, the whole issue of boosters, which is one of the hottest topics at the moment, certainly in high-income countries, there are several aspects. One where there is, I would say, consensus, if not unanimity, is that people who are frail, who are immunosuppressed, for example, and all that, they need an additional injection. And that's not unheard of. That's true also for how they react to other vaccines. So you could even argue that that's not really a booster, but that is, I would say, something that we all agree, and that many countries also in Europe have agreed. When it comes to offering a booster to more of the general population, or like in the US or in other countries, Israel and so on, for anybody who has been vaccinated like more than 6 or 8 months ago, there's debate. From let's say, as a virologist, I would say it doesn't hurt, and it probably boosts your immunity. But the question is, what are we trying to achieve? What's very clear, and we heard it also from the minister, the people who are now in the hospitals and who die, nearly all of them were not vaccinated or incompletely vaccinated. So there is a strong indication that vaccines work and protect against that. For how long, we don't know. And then there is another aspect, and that is one of equity, including in Southeast Asia, the ASEAN countries, which is a very diverse region in terms of, economic development and so on. And that is that, if we are going to spend the still limited supply of vaccines, and that's limited supply will, I think, end in, certainly in 2022, there will be enough. And I was very happy to hear that also Singapore will produce and others. That means that it's a zero-sum game, that you will deny vaccines from people who have not been vaccinated at all. So that's a debate that is going on. But I also tell scientists who are sometimes frustrated if decision makers don't follow what they tell them to do. I said, we're advisors. We're advisors. And if you really want to, be in charge of decisions, you have to go into politics and make sure that you are in charge. But it is indeed going to continue to, to be a challenge to deal with uncertainty, to have to take decisions before this full evidence. But that is not unheard of. That is true for any business. You try to figure out what is the best strategy, the best projections, and what have you in whatever sector. But you have to make, decisions. And in the absence of full data, that same is true for social policy, for the economy, for any decision maker. And we also have to make sure that there is one point where I think there is no excuse, and that is for deliberate misinformation. There is a difference between healthy debate or questions about, will this work or not, or, spreading misinformation, which has led to really, in some countries, major impact on, for example, refusal of vaccines for reasons that have not much to do with vaccines often. It's about something else. And so that's something that we have to deal with as well. So it's not all equal. In science, we like someone who is a bit of a weird idea, unconventional, but most of these are, are not based on anything scientific, and therefore can be very risky when it comes to, for example, the need for as many people as possible in the world to be vaccinated, because that's the way to make our societies safe again.
Do you think also there is a need to create more, say, surveillance labs, detection systems against future viruses, diseases, especially in places where the viral leads from wildlife to humans, for instance?
Oh yeah, definitely. When there's a small epidemic of commissions and committees to learn lessons and be prepared for the next epidemic. I co-chaired actually with our good friend from Singapore, with Professor Leo Yit Sing, who's the head of the National Center for Infectious Disease Control, for the G20 summit, the G20 EU summit in Rome in May on global health. And the number one proposal, well, the number one recommendation, well, the number one was continue to invest in R&D. If we have vaccines today, it's not that they just were made up in 2020. They were possible because of investments of decades in research and so on. So that needs to continue. That's really important. But the second one is to get serious about surveillance. And here, as we heard also, some of the countries in ASEAN were ahead of the rest of the world because of SARS, and because institutions, because of systems were set up. But we need to invest, and I like what you said about this. Is not only about surveillance in humans, but also in other animals. Let's put it that way, because all these new emerging infections, they come from animals. They're zoonoses. And so we know this, and it's very well done for influenza. There is massive surveillance in birds, in poultry, and so on, trying to detect whether a new strain, variants as we call them now, for SARS viruses, for COVID viruses, SARS-CoV-2, that we know that something is brewing in that population, and there's a worldwide network. Now, surveillance is a national issue. Of course, you need to know, and because if you don't know, you can't act. That's really important. But it's also important to exchange information. That was not always the case in the early days of the pandemic. Particularly with neighbors, you need to know if your neighbor's house is on fire. You need to know. You will see it, but it's all important, therefore, that there is regional collaboration. In Europe, we have the European Center for Disease Control that collects and makes sure that information is shared among the EU member states. I hope that in ASEAN, that there will be or is also that kind of exchange of information. And in our digital age, that is really key. And we should also go beyond the classic Ministry of Health type of collecting of data from hospitals and so on. We have, the social media, we have the really very rapid access to what's going on and to detect signals of a new infection, of something that is unusual. So this sharing of data is really important, and there needs to be money for that. It means that we need to invest in, let's call it in peacetime, in between epidemics, to have these systems and to make sure there is this openness, transparency of data among member states, within a member state, and internationally.
Just before we get to the Q&A session, where we open up the questions to the floor, I thought maybe each of you can just give us some of the key lessons and takeaways you have from this pandemic. Perhaps we start with you first, Mr. Engler.
I think just be prepared for the unexpected and try to stay as agile and fast-moving as you can and react to whatever comes your way.
Anyone else wants to jump in? Ms. Sterling?
Yeah, maybe I can say something along these lines also. I mean, frankly, anything can happen. You can't predict everything. But one thing we know, there will be other epidemics and there will be pandemics. Some may be worse than what we have now, some hopefully, and some not. And therefore, we have to be prepared with resilient systems and regular, I would say, drills, fire drills, and gaming. That's what I think will be important also to make sure that we are, better prepared and also psychologically, mentally. But if we don't, never miss a good crisis, I say. And that means in this case also, let's make sure that we are better prepared for the next one. And you cannot prevent that new viruses will emerge, new epidemics, but new outbreaks. But what we can prevent is that they turn into a huge pandemic and a huge epidemic, and that we have this massive societal damage. Thank you.
Mr. Sterling?
Yeah, from my side, I think four key takeaways, right? The first one is the use of real world data, the use of real world evidence to understand how our ability to manage the epidemic or, different diseases, right? Really be in tune with the latest data of the outcomes that we are delivering to the population. The second one is obviously the use of new digital tools that can really make a difference in this journey. The third one, actually, I think that there's some major learning in terms of our ability to collaborate cross-functionally. And then the fourth one, and I think it has been said, we need to highlight the resilience of humanity. And I've seen so many examples of humans, doctors, putting themselves at risk to save patients. So that resilience of humanity is what will allow us to get better and better at managing the different healthcare challenges that we have in front of us.
DSG? Yeah.
Well, I think when it comes to building resilience or preparedness, I don't think that we have a lot of good story to share. There's always the thinking that it's too costly for us to invest in building preparedness and resilience and so on. But the time is now for us to start doing something about that. And in response to Professor Peter Peart, we are now in the process of establishing the ASEAN Center for Public Health Emergency and Emerging Disease. Although the name is not yet final, we are still, working on it. But that's the ASEAN CDC, and along with it, there will be a legal framework that will allow the member state to share, information and data in a timely manner, and also a possibility of, having a group of experts, to go to the countries that are affected by this kind of crisis, so that they can also support and provide, early assistance and so on. And when it comes to transparency and accountability, we also have this ASEAN portal, for public health emergency. All the data, information, and responses of all the ASEAN member states are there. So I think we learned from this crisis that it's important for us now to, do some things that is contributing to our long-term plan to build resilience and all that. I don't think that, the old argument that it's too costly for us to start doing something about preparedness and resilience, I don't think that it makes economic sense, as we can see the devastating impact of this COVID-19. So again, we are, reaching that goal in hopefully by the end of this year, so that we can have this regional mechanism to support the ASEAN member state to prepare for another big crisis like this.
Thank you. One thing I may want to just interject is that I was involved in SARS. When Professor talked about Liu Yisin, I was a young registrar at the time, and Prof. Liu Yisin was in charge of the Tan Tock Seng Infectious Diseases Unit at that time, where we were looking after SARS. And I remember coming out of that, so when you ask about the lessons learned about this crisis, I would say, well, this crisis is not over, so perhaps the lessons we're learning not all done yet. And I had to think back a little bit to the lessons we learned from SARS, that perhaps 17 years ago got us perhaps a little bit better prepared for this pandemic. But I think the key lessons were really not about the specifics of the virus, or the therapeutic strategies, or the research and development, or the capability in healthcare, all of which were important and were triggered. But I think the key thing was the continual work around social trust, the partnerships with the private sector, whether they were in the bio and pharmaceutical sectors or the rest of the supply chain, the social trust between people and institutions, the institution building that then allowed us to perhaps have some tools ready for this pandemic. I think that's going to be the key types of lessons that we have to take out from this crisis, because the next disease, the next crisis isn't going to have the same characteristics. It's R naught, it's K, its dispersion is all going to be different. So our strategies will be different. But the reliance on that social trust to bring people along on the journey and to accept hard truths and do what needs to be done isn't going to change. The need for the partnerships with the private sector locally as well as internationally, and that standing trust and relationship in order to get what needs to be done isn't going to change. And the need to learn and be part of an international and regional network of connectivity and a community of professionals isn't going to change. And I think those, to my mind, I think are likely to be the lessons I will want to learn out of this pandemic. But I would say it's not over yet. We mustn't celebrate too soon. And we must keep learning as we go along.
All right, thank you. Okay, we have 15 minutes for any of your questions, burning questions you have for our speakers. At the moment, I don't quite see any questions online at the moment. Who do we have? Okay, we have a gentleman over there. Somebody will come over with a mic. Chris himself.
Good afternoon. My name is Sahalan. I'm from Shell. So the question is about vaccine access. Now, I think in Southeast Asia, we are seeing a lot of cases rising up in the past few months. Vietnam, Philippines, there have been difficulties for them to get vaccine. Now, so the question is there, I mean, the way to get vaccine, I know there is an international arrangement to COVAX, and Shell has actually donated to the COVAX system. But in addition to COVAX, is there a way whether to increase ASEAN, or does it really have to rely on the government to government to get these vaccines into countries like Cambodia, Philippines, Vietnam, where especially in the rural areas or in the outside the urbans, it's really difficult to get that vaccine access, and that actually prevents the economies to open up. And I think when we talk about it's going to be difficult, I think, for ASEAN, because ASEAN is so connected. At the same time, this the opening route is not even across the ASEAN countries. So we'll be really interested to hear the views maybe from you, Minister, and also maybe from Professor Peter and the ASEAN Secretary. Thank you.
Perhaps DSG could kick things off first in terms of vaccine access. Is it more government to government, or are we talking about there is a way to get it through COVAX, but as borders of different rates of opening up?
Well, thank you for the question. Actually, there are two important tools that we have here at the regional level. Actually, before the COVID-19 pandemic, we have this framework, to build vaccine, security and self-reliant. And Thailand is taking lead on that. And actually, it's just the beginning of implementing the framework. And now that we have this COVID-19, so through that framework, member states working together to build the manufacturing capacity and capability, and also looking for ways on how they can procure vaccines together, because normally if it's just one individual country is doing all of this, it's going to be very difficult, and the cost is also very high. It's just the right time that they are starting to use this framework to do some things on the procurement of vaccine. As of now, we don't have much progress on that front. Another way is that ASEAN is supporting the member states through the ASEAN COVID-19 Response Fund. It's still a very small fund, I have to say. And we are trying to procure, some vaccines through a COVAX facility. But again, it's still small numbers of vaccines here. One thing that I would like to highlight, most of the vaccines are now procured by individual member states. So you can see that some manage to get a lot of vaccines while others cannot find enough vaccine to vaccinate the people. That's why the vaccination rate is very different. Some countries less than 10%, and then you have 20%, 30%, and only 4 or 5 countries that are above 50% and so on. There's a lot of discussion at the moment among the economic people, on how they can work together to procure vaccine as one collective body. But as of now, I have to say is that there's not much progress yet. But that is some things that they're looking at, especially for those countries that are in a better position to bargain with the private sector or have an access to procure more vaccine and so on. It's still a long way for them, although we have the framework that would allow them to work together. But I think, they need to double the efforts, especially when it comes to pulling resources together and pulling efforts together to procure vaccine as a collective body. As of now, there's not much going on in that front. But we have the framework to assist the member state in doing so.
And also, I believe Singapore, for instance, I mean, not so much vaccine access, but for instance, with Australia, we've got a swap deal with them where, we give them X amount, and then by year end, they return us X amount. And I think Australia is also giving out their vaccines in Indonesia and these other places. How does that sort of collaboration work?
Well, I mean, precisely as you've described, because of where we are with our vaccination program currently, there isn't a pressing need for us to hold so much stock. As we look forward and we anticipate what will happen later on in the year, we can anticipate a surge of need later on, and Australia is in the reverse situation. And so that then allows a certain natural partnership. So this type of arrangement is one of many, and I think there are various routes and platforms, as ASEAN Secretary has just described, DSG has just described, that we can address this. So I take the point of the question that this is an issue in terms of a rate limiting step, but it's not that there haven't been and aren't going to be an ongoing effort by everybody to try to deal with this, and we will find ways to deal with it.
And for Novartis, I mean, like, is there any way where, I know that there is that urge to obviously speed up, vaccination and trying to, increase your research and all of that. But is there any sort of role that Novartis or, BioNTech, these vaccine makers, can play in terms of, equity and vaccine equity and all that?
Yeah, sure. So I think it's a very, very, very good question. And for example, we have, for example, in a different area, in the area of medicines, right? We have signed a very innovative agreement for what could be an innovative technology for treating patients that are already ill. A new technology that is called DARPin, and for that technology, the deal of the product that we in-licensed contemplated the ability to make it much more accessible to emerging economies, even in terms of cost, right? In order to be sensitive to the reality and to be able to serve patients in emerging economies. Because if we are very, very conscious of the trends that are progressing, it's likely that the bulk of the patients that fall ill and that are in need of medicines could be in these emerging economies. So we do believe that pharmaceutical companies have a role to play, and we call this responsible access and partnering for making medicines available around the world.
Thank you. Do we have any more questions from the floor? On the floor? Chris, go ahead.
Thank you. We've heard a lot talking about vaccines and COVID-19, but what about the impact on the rest of the healthcare system as a result of the pandemic? So we see delays in elective surgery, we see delays of people who have to see doctors to get medicine. Is there not a need perhaps to provide more over-the-counter medicines for people so they can treat themselves better without having to call on primary healthcare providers? Perhaps a need to have more e-pharmacies perhaps, and then firms like Foodpanda can hopefully do that last mile delivery as well.
Minister, you want to take that, or?
Well, I mean, we may need all of those solutions and others. I think you have to look at the context, and I mean, I think the solutions are going to be quite different in different ASEAN member states, partly because your population distribution, your healthcare structures are different. But certainly for Singapore, people have been exploring a variety of solutions like that, including delivery, leveraging on some of the much more robust and granular logistics networks that we've developed over the last couple of years. But I think for us, we've been quite fortunate that largely our healthcare delivery has proceeded unaffected. So mostly elective surgeries and elective appointments and so forth have been able to continue. Not in exactly the way it was pre-COVID, and as someone's already said, we're never going back there, but we have been able to have most of our BAU happen, some catch-up happening, and largely our healthcare system has been able to continue with the non-COVID work, which is part of our consideration then as to how fast we should open up or how slow we should go, because our capacity does need to take into account not just what the effects might be in terms of our ability to deal with COVID, but what the knock-on effects of that might be in terms of impinging upon our business as usual and the healthcare of the rest of the population. And so that's part of our consideration then of where we are today, in just waiting out this wave and to see what the effects will be on our healthcare capacity. But sure, I think we certainly should be exploring all of those types of solutions to be able to deal with this new set of challenges that are before us.
Yeah, I think it's always a good question to ask what a company like Foodpanda, a tech company like Foodpanda can contribute in such a situation, right? And we have been focusing on a lot of aspects to link it to the question just asked. I think one aspect we have been focusing a lot is on access of over-the-counter medicine and also access of self-test kits. So we expanded our assortment very, very early on, also in combination with the regulators in terms of licensing and so on, to include over-the-counter medicine in our Panda Marts. So, to treat mild vaccination side effects and so on. And that has been very well adopted and seems to be working fine for us. Even more interestingly, in Singapore, we work very closely with the government to include test kits, self-test kits in our assortment. And it's actually today the #1 sold item in Singapore in our Panda Marts. And so I think here a company like Foodpanda has a role to play and can contribute. Another topic which we have been focusing a lot is also on somewhat education around vaccination. Across the region, we operate a rider network of 200 to 300,000 riders, and obviously those riders are very exposed and also expose others very, very much, restaurant staff, consumers, and so on. And on top of that, in many countries, those riders happen to be also exposed to a lot of misinformation out of various reasons. In particular, I think the example where we collaborated the most with governments is in Philippines, probably, where misinformation is around vaccination is just a very big problem. Equally to access and having enough vaccines. Even if you have enough vaccines, you need to get the people willing to get vaccinated. And particular for our rider network in Philippines, that has been a huge problem, just simply because they're exposed to so much misinformation. And so we have been working very closely on various measures where we provide a lot of information in our rider technology in the app the riders are using to do the Foodpanda deliveries. But even we went so far to have TV spots aired really with the intent to actually educate our riders to get vaccinated. And yeah, I think those are examples where companies like a Foodpanda, tech companies like a Foodpanda can work and enable a better handling of COVID in general. Yeah.
Thanks very much, Angela. And thank you very much, gentlemen, all our guests here, for your time. And thank you very much to all our questions from the floor. I'm afraid that's all the time we have. I think one thing is clear, this pandemic is still going and there's still much for us to learn. And definitely the public and private sector has their collaboration's got a big role to play. Thank you very much, gentlemen.